Thank you so much. Well, good evening. My name is Rebecca Miller, and I am the president of the League of Women Voters of Clallam County. League of Women Voters is a national, nonpartisan, nonprofit organization whose purpose is to promote the informed and active participation of citizens in government. We welcome both men and women. I want to underscore the primary tenet of our organization, nonpartisanship. In the 101 years since we were established, we have never endorsed or opposed a candidate or political party at any level. We are ardent about positions that we have done extensive studies on, but we never favor a particular candidate or a particular political party. We are truly grateful and impressed by those of you who are participating in tonight's forum. To the candidates, for your willingness and courage to run for office. To the audience, both here tonight and who will be viewing it on Zoom later, for your involvement in the democratic process. To North Olympic Library System for managing all things Zoom, and the local league members who have expended a great deal of time and energy to make these forums fair and informative. So tonight is my very last forum as the local president. And I have to tell you that it has been an honor to represent some of the most dedicated and hardworking people that I have ever known. We want informed voters, and we are proud to host this forum tonight. I would now like to introduce you to Linda Benson, who is the immediate past president of the League of Women Voters of Clallam County, and she will be our moderator for this evening. Thank you.
Thank you, Rebecca. I want to welcome all of you as well, and the audience that has tuned in. I can't see that many faces, but I can see that you're there in numbers. So what I want to do is just give you a little bit of information first. And the first thing I have to do is thank the Olympic Library System for co-hosting, and specifically Sarah Morrison for being our techie. She's been fantastic and done that for all of our forums, and she may be sorry because we'll probably be asking her to do it more. Also, Bonnie Bliss Banish is our timer tonight, and she has a special skill with that, and she'll explain that to everybody in a minute. She's a member of the board here in Clallam County. And I want to tell you about our website, which is lwvcla.org. And you can go there and get lots of information. One of the main things that we have there, and I've got blur on, so I'm not going to be able to show it to you. I have blur in the background. We have a TRI brochure, and TRI stands for They Represent You. And it's a little folder that has all of the elected officials, local, state, and national, and contact information for them. So you can go online, you can go on our website and see it, or you can pick up one at the library or different places around town. Mostly the library is where we have them. So please grab one of those. It's very informative. The other thing I want to tell you about, and the candidates should already know about this, at the state level of League of Women Voters, they have a site called vote411.org. And you can go to that site, and what they have done is they have sent to all of the candidates specific questions that the candidates answer themselves, and it's all typed in. So you don't see anybody, but it's all typed in, and they answer the questions in their own words. One of the things that we really believe in is that you should hear directly from the candidates, and the Vote 411 site does that, as well as our forums. That's what they're for. At that site, you can also see what's on your ballot, and you can check your voter registration. And that's going to go live tomorrow, October 1st. So please go to that site. It's very informative. We believe that you as a voter need to have the opportunity to have your questions answered before you sit down with your ballot. I think we've all experienced sitting down with a ballot and then maybe not knowing exactly who we want to vote for, but that's what these forums are for. So the views expressed here are those of the candidates and not of the sponsors. And just another announcement tonight, after the panel that we have for the hospital district, all of the candidates for the SQUIM school board were given the opportunity to come and do a 2-minute introduction of themselves and answer the same 3 questions that we ask all candidates to answer. And only one of the candidates took us up on our offer and accepted it. So right after this, Patrice Johnston will be running, who is running for the SQUIM school district board, will introduce herself to all of you. Olympic Medical Center in Port Angeles is in Hospital District 2, and it covers 2 of the Eastern County Commissioner districts. And it was interesting, I just looked at the map and it goes all the way past Lake Crescent. It's huge. It goes a lot farther west than what I certainly knew before I checked on it. It goes past Lake Crescent, and it includes some of Beaver District. And then Hospital District 1, that hospital is in Forks, and that really does serve the western end of Clallam County. Tonight on your screen, you will see each of the candidates with their name and the position after it, so that when they speak, you'll know exactly who that is. And we're going to start with each candidate will have 2 minutes to introduce themselves. And we've asked them to answer 3 questions that they had ahead of time. What are your qualifications for the office? How do you intend to deal with the key issues confronting your area of responsibility? And what is the primary goal you hope to accomplish in the first year of office? So when we've completed those statements, I'll ask questions. They'll have 1 minute to answer. And then we'll have, depending on our time frame, we might have 1 or 2 minutes closing statements, usually just 1. So Bonnie, would you show us what the timer is all about, please?
Sure. You will always see the timer on your screen if you have, unless maybe you're on a cell phone. And basically the way it works is once Linda, the moderator, asks a question, once the candidate starts to answer the question, I will start the timer, a countdown timer. It starts with a purple background. And once it gets to 15 seconds, the background turns to yellow. And that's a signal that the candidate should start wrapping up. When it gets all the way down to 0, it turns red and there's a stop sign. Candidates can go ahead and finish the statement that they're on, finish that sentence. And then if you keep on going, then the moderator might come in and ask you please to stop speaking. So that's the way the timer works. In the last couple forums, at sometimes a candidate wanted to hear a question repeated, and that's fine. If you want to do that, then we won't start the timer until you actually start answering the question. Thank you.
Okay, thank you, Bonnie. And I just got a message in chat that Heather Jeffers has just arrived. I can't see you, Heather. We're glad that you're here. There she is. Okay. Welcome. I was just quickly trying to figure out how I was going to reorganize people answering the questions. We start with opening statements and we do them in order of filing. So Heather Jeffers, you're actually first, and you have 2 minutes for an opening statement.
Okay, hi. Let me, I'm having a little bit of challenge in my hotel room here with my devices. So I'm trying to get to where the proper screen. So bear with me.
We won't start the timer until you start your 2 minutes.
Okay, and I can't see the timer. So
Okay.
but I don't think I'll go over, so it's fine.
Okay, can you see me?
Yes, no, I cannot see you right now. I can't see anything. I'm just gonna speak and hope you, can you see me?
Yes, we have your picture at this point.
Oh, hold on. I had my camera on, just a moment.
Okay. Now can you
Okay.
see me? You can't see anyone?
I can see you,
Okay,
but I'm trying to switch my screen here so that I have the proper stuff that I need. Okay. All right. I'll just get started then.
okay. We do see your face. We don't see you actually right now.
Okay, I
Okay.
don't know how to help that at this moment. So can I go
Okay,
ahead and just
And if
talk?
you can see me, what I will do is I'll do what Norma did last night. We had a candidate that couldn't see the timer. And so she held up 10 fingers when there were 10 seconds left. Will that be helpful to you?
Sure.
Okay.
Okay.
Okay, are you ready then?
Yeah.
Okay, you have 2 minutes.
All right. Well, I'm Heather Jeffers, and thank you for having me. And I am asking for your vote to be your next hospital commissioner. First, the issues that are most important to me are quality healthcare for everyone without having to leave the peninsula, keeping our hospital locally owned and operated, reducing ER wait times and improving ER services, and improving patient safety and outcomes. Second, here's why I'm the most qualified candidate. I have a master's degree in social work, and I'm a certified geriatric mental health specialist. I've worked over 20 years in healthcare in various roles, and I'm a licensed nursing home administrator with a proven track record of success. Third, here's why I want to serve as your hospital commissioner. I have spent my entire career helping patients and families. Now I want to continue pursuing my passion on a larger scale to help the residents of our community that I have been a part of for the past 18 years. As a medical social worker, I was a patient advocate, helping patients and families navigate their way through our complex healthcare systems. As a nursing home administrator, I have spent the last 9 years running operations of a 90-bed, $20 million organization. I've turned 2 facilities from 1-star Medicare rating to 4- and 5-star rating, reduced staff turnover significantly, exceeded budgeted financial goals every year, and greatly improved patient and staff satisfaction, all while relying solely on government payers and extremely thin margins. If I can accomplish all of that, then I know I can make a positive impact on the OMC board while continuing to be the voice of all residents of our county. My current work in the post-acute rehab and long-term care setting is not a conflict of interest, but rather a front row seat to the impact of the hospital commissioner role. Thank you very much for your time and for having me here, and for your interest in this important position. And I ask for your vote to give me the opportunity to serve as your hospital commissioner. Thank you.
Okay, thank you. Karen Rogers, you have 2 minutes for your opening statement. You're on mute. You're muted. There you go.
Good evening, I'm Karen Rogers. Thank you very much for having us all tonight. My qualifications for OMC Commissioner include previous service as an elected official, proven governance role, long-term community involvement with the EDC, Chambers of Commerce, Peninsula College Foundation, United Way, Boys and Girls Club, and many school district bonds and levies. Additional credentials include 18 years of volunteer advocacy for and engagement with OMC. I'm an advocate for funding at the federal, local, and state levels. I support improving access to healthcare, promote patient advocacy, and have been attending board meetings this year and before that. I've engaged in independent study for this role. I have an in-depth understanding of the budget, strategic plan, capital needs, and lastly, I've been active in philanthropic work, benefiting OMC's Heart Center, Pediatrics, Cancer Center, and many programs over the last 15 plus years. With my knowledge, my passion, and my leadership and skill set, I will work together with my fellow commissioners to address the key issues such as staffing shortages, recruitment, retention, reimbursement, capital and strategic planning, and COVID recovery, all for the betterment of quality and safe patient care. I will serve with accountability to the citizens of Public Hospital District Number 2. My primary goal in my first year of office is to do everything I can to assist the district's recovery from the impact of the COVID-19 pandemic, specifically in terms of staffing, finances, patient needs, patient procedures, and meeting the goals of their strategic plan. I stand ready to serve you as a community representative on the OMC Board of Commissioners. Thank you very much.
Thank you. Tom Oblock, you have 2 minutes.
Good evening, everyone. My name's Tom Oblock, and I'm the incumbent hospital commissioner from Sequim. I have 47 years of healthcare experience. 37 of those years are in operations, and 10 years of those are in governance. I was appointed to the OMC board in 2012, elected in 13 and 15, and I also served as the board president in 2015. My current assignments are the Human Resources Committee and the Quality Management Oversight Committee, both of which I am the chair. I am also a member of the Strategic Planning Committee. My goals for OMC are to have it remain locally owned and operated, expand primary care and improve access, reduce wait times in the emergency department, improve the patient experience and continue to improve the patient experience, and promote a culture of safety. This will be best done by following our strategic plan. Having said all that, I will turn it back to the moderator.
Okay, thank you. Jim McIntyre, you have 2 minutes. You're muted.
Thank you very much. Linda, if you would do me a favor, the timer seems to be stuck on my computer. My internet is kind of iffy sometimes. So if you
Okay.
wouldn't mind holding up 10
you want
fingers
10?
when I'm about to finish.
Okay, is 10 okay?
Okay, yeah, that'd be great.
Okay,
Okay, Jim McIntyre, running for the second position of the first district, which represents the Sequim area for the Olympic Medical Center Board of Commissioners. Thank you, League of Women Voters, for the invitation to speak with your audience tonight. I certainly appreciate it. I look forward to the questions. The last 18 years of my professional life were spent in a variety of positions that had to do with organizational strategy at the high level, budgets in particular, and annual performance plans. I think it's a good practice, as a matter of fact, a best practice for any corporate board or government board that's elected to represent a broad spectrum, a wide variety of professional backgrounds, experiences, and the like. I certainly bring that to this position. And the highlight of the 18 years is the last 8 of which I served in 2 elected offices here locally. One as a port commissioner for the Port of Port Angeles, representing the Sequim area, and also as a county commissioner representing the commissioner district. So why am I running? The primary reason is, of course, to keep the Olympic Medical Center, the hospital district, under local control. There are some fiscal difficulties that are very foreseeable on the horizon, and the Board of Commissioners can certainly anticipate having to contend with them. And so the particular skill that I bring is in budgeting and strategy and legislative advocacy. I've had a lot of experience of that, both in Congress and in Olympia. So I look forward to the questions that you have. I have the zeal to serve the public once again after another 46 years of service, and I look forward to your vote. Thank you.
thank you. Tom Hightower, you have 2 minutes.
Hello, Tom Hightower. Welcome, everybody, and thank you for coming to hear us this evening. I feel quite humbled by the other candidates who are running tonight, and I'm impressed by the quality of their experience. And I look forward to telling you a little bit about myself. I'm an incumbent. I'm unopposed. I've been on the board for 4 years now. I was initially appointed and then elected 2 years ago to complete the term. And this time I'm running for the 6-year term. I'm a retired RN. I've been in the Column County for about 6 years. And I was in healthcare for 40 years plus in various positions of leadership in small community hospitals primarily. So I have both a clinical background and a leadership background within these community hospitals. As mentioned, I've been in the commissioner position for 4 years. I have served on multiple committees within the OMC, including quality and safety, budget and compliance, and it was involved with the selection of a number of our executives over the couple of years that I've been there. I'm also involved in the community, both with the Olympic Peninsula Community Clinic and with the Olympic Peninsula Healthy Community Coalition, both organizations involved with looking at the quality of healthcare within the county. The issues that are facing OMC, obviously the COVID, the public health emergency, but that public health emergency has highlighted financial viability, manpower issues with recruitment and retention of staff, and also, as mentioned before, looking at keeping the control of the hospital in local hands. My primary goal for the next for the next 6 years is to continue listening, continue learning, and continue being a voice for the community in the hospital. Thank you very much.
Okay, thank you, everyone. We'll be starting the questions now. These are questions that people have sent in to us. And I did have a lot of questions that were about the same issues. So I have consolidated, so questions and issues aren't necessarily repeated, but we did cover all the issues that were sent in as questions. And the first one I'm going to throw at you, and I'm going to change it just a little bit, because initially the question read, what are the major issues facing the hospital district going forward? And I think every one of you in your statements, in your introductory statements, told us your feelings about that. So, well, I'm going to make it harder. I'm going to say, what's the first and most important issue that you feel the hospital district needs to work on? Let's see. Heather Jeffers, you have 1 minute.
Wow. Okay.
It's a hard question.
I know. I'm thinking that was a lot. The first issue, did you say?
Mm-hmm.
Well, I mean, obviously, what's happening right now is COVID, right? So that, and I'm dealing with that in my own facility. So with that, it's the COVID recovery and the staffing that goes along with that, the vaccine mandate that contributes to the staffing problems. So I feel like that's probably the first and foremost issue that's right on the front burner that needs to be addressed.
Okay, thank you. Karen Rogers, you have 1 minute. Same question.
So the key issue before us right now is the financial recovery of the pandemic, and more importantly, what happens should the pandemic continue over the next couple of years, because it affects the sustainability of the hospital. It also affects completely the staffing of the hospital. So these are very critical issues and very critical timing what's in front of us. And you've got to pay attention to the financing at the same time, balancing also the incredible importance of the employees. And I will tell you, we got a lot of work to do.
Okay, thank you. Tom Olblock, you have 1 minute.
As it stands today, I would have to agree with Heather that it's staffing. Healthcare workers over the past year and how many months it's been since COVID has been in our midst, these folks have been engaged in a war. Some of them have died. Some of them have been wounded. Some of them have suffered from PTSD. Others just said, I want out. This is a problem that extends nationwide. And this is a problem that's going to have to be addressed by the healthcare system in general. But it is a concern for me, and it is a concern for Clallam County. And I will work hard at getting our staff up to level that allows us to provide the best quality patient care that they can. We have a good recruitment program. We promote people from within, and we have career ladders, all things that help us keep our staffing up. Thank you.
Thank you. Jim McIntyre, you have 1 minute.
Good question. I'm gonna talk about the most important strategic questions facing the hospital district. And certainly I don't mean to minimize the stresses brought on by the pandemic that we're in, but eventually that will pass or at least diminish. The biggest strategic question, I think, is the financial viability of the hospital district. I've been talking about the impending exhaustion of the assets of the Medicare Part A trust fund. That's the trust fund that pays for inpatient care. If Congress does nothing, and that's a jump ball, given today's headlines, the hospital district will face about a 9% cut in revenues for inpatient care. We need to
Jim,
focus on that and
Jim,
figure
can
out
you, Jim,
an
sorry,
advocacy plan and an
Jim.
efficiency plan so that we can cope with that.
Okay, Jim, I gave you the 10 seconds. I don't know. Can you see the
Yes.
timer, or you didn't see me maybe? Thank you. Okay. Tom Hightower, you have 1 minute.
All right, what comes to mind, and it's already been mentioned by two other candidates or three other candidates, is the financial. And the old adage is no bottom line, no mission. The continued viability financially of the hospital is a key component. Nothing else works. Quality of care, staffing, all of that kind of follows the money. And that, in my experience, and one of the things I've been impressed with, having been at OMC, is their leadership, their financial leadership has been superb. Their involvement with advocacy, both at the state and national level, and trying to shape legislation and shape reimbursement, has been superb. So I would continue to follow the lead of people like Daryl Wolf and the financial people of the hospital and the leadership of the hospital to continue in the direction we've been going. They have been managing it and touring and setting course very well for the last number of years I've been involved. Thank you.
Okay, thank you. I just got a note from Sarah. Jim, she is suggesting that if you're having trouble with the audio connectivity, if you turn off your video, that might help the audio. Sometimes the internet or Wi-Fi gets overloaded. It's not ideal, but you may need to do that so that we can make sure we hear you. And I did give you the 10-second warning, but can you see me? I just want to make sure everybody's connected where they need to be. Did we lose Jim? Gosh, okay. Well, hopefully he'll come back on. I'm afraid he might have lost audio. So let's go ahead then. Interesting. My second question, I think most of you have already answered, and it was concerning the high percentage of Medicare and Medicaid patients, and how can we assure operating costs are fairly covered for our providers and the facility while keeping facilities running financially. So you obviously, all of you consider this an important issue. So let's do another minute. I'll give you another minute to talk some more about that. Karen Rogers, you have 1 minute.
Certainly, if you look at this from a business plan, having a revenue stream that is always in the negative is not a sustainable plan, bottom line. The hospital has to start looking at help with their partners who are able to get a better reimbursement rate, for instance, Medicaid patients. I want to throw something out here. Maybe it's time a federal qualified facility maybe handles the Medicaid patients so that the bottom line of the hospital can improve. I have been in advocacy work with the hospital, volunteering a lot, and it's deaf ears in Congress about helping the size of our hospital. And so it's going to take extreme vision and practice on the finances to make sure we stay sustainable. And it's a model that is very dangerous, and it is very susceptible to any change. If Congress reduces any funding, we're going to have to get very creative in the services that OMC provides.
Thank you. Tom Oblock, you're next with 1 minute.
Reimbursement cuts are nothing new to any hospital in the country, let alone OMC. We have specific quality indicators that are present in our strategic plan that as long as we hit them, we will likely stay locally owned and operated. A 2% bottom line. We have a great debt to equity position. I think it's around 33%, which is about the same as having a house payment. And we have over 90 days of cash on hand. We have excellent leadership at the senior level as far as finance and quality control go. I think these folks, along with those efforts and their advocacy efforts, will work well in keeping OMC locally owned and operated and provide us the opportunity to hire quality providers.
Thank you. Jim McIntyre, you are next. I don't see you. Are you there? Can anybody see Jim?
I'm here. Linda, can you hear me okay?
I can hear you now. You cut in once in a while, but did you hear the question?
No, please repeat it.
Okay.
Internet hiccup, and I apologize for that.
Well, that happens to all of us, so we'll just try to keep you in the loop. There you are. Did you hear that our tech expert, Sarah, had suggested that if you turn your video off, your audio may be better? So we wouldn't be able to see you, but we could hear you if you'd like, if you want to try that.
Yeah, I'll do that. Hopefully that'll help.
Okay. So let me know when you're ready, and then I'll repeat the question.
Are you hearing me okay?
Yes. Yeah, your audio isn't very good, but we can try it. I'll repeat the question. In light of our district.
I think I'm ready if you can hear me okay.
Okay. All right. I'll repeat the question for you then. In light of our district's high percentage of Medicare and Medicaid patients, how can we assure that operating costs are fairly covered and our providers and facilities are financially viable? So you have 1 minute. Boy, I'm afraid he's gone again. Jim, are you there? Boy, I'm sure sorry about that. That can happen to anybody, I'm afraid. I was in the middle of the Zoom meeting the other day and I was hosting, and we lost all electricity. And so everybody was out. So I apologize. Let's go ahead and Tom Hightower, we're going to give you a minute, and then hopefully Jim will get back into us, and then we'll let him have his minute.
I'd like to follow up a little bit on what Tom Oblock was talking about. Hospital financial services, the mechanisms by which hospitals are reimbursed, is an exceptionally complex, sophisticated system. And you're absolutely right, 85% of our reimbursement is from public resources. So advocacy is a key part of what we do insofar as at the national and at the state level for both Medicaid and for Medicare. Also, the hospital is primarily, well, not primarily, in the past was primarily inpatient, but it's both inpatient and outpatient now, and much of our income also comes from the outpatient side. So ambulatory care is also an exceptional part of the strategy the hospital took on a number of years ago to look at maintaining its reimbursement sources and maintaining a financial viability. So I would, again, re-emphasize the fact the hospital's done an exceptional job when it comes to advocacy. Thank you.
Thank you. Jim, are you back with us?
I hope so. Can you hear me okay?
We can hear you now. Did you turn your video off?
I did.
Okay, yeah, that should help. Now, do you want me to repeat the question or did you hear it again?
I would like you, I would like to hear the question again, if you don't mind.
Okay, no problem at all. In light of our district's high percentage of Medicare and Medicaid patients, how can we assure that operating costs are fairly covered for our providers and facilities while keeping facilities financially viable? So you have 1 minute.
Great. Two things come immediately to mind. Number one is trying to develop a coalition, if none exists currently, of hospitals that are similar to OMC, to advocate forcefully to our legislators, both in Congress and in Olympia, for fair reimbursement of the necessary costs of doing business, both inpatient and outpatient. That's crucial. The second thing is, as I mentioned before, a continual quest for operating efficiencies so that we can be as lean and efficient as we possibly can. I think that's the bargain that needs to be struck with
You
our
have, Jim, you have 10
funding.
seconds.
Okay.
You have
I
10
think
seconds.
both of those things are really necessary. Got it. Thank you.
Okay, thank you. Heather, are you with us? There you are. I see your
I
face.
am.
You have 1 minute.
Okay. Well, it's interesting to me because in my business, we are 100% Medicare and Medicaid. So the idea that that's a problem that is interesting to me because that's all I know. And so that's a challenge that I have to deal with that in my entire career. So with that being said, I mean, we have budgets and it is managing and sticking to the budget, and it is maximizing your revenue, reducing expenses, avoidable expenses. Looking at one of the things that the hospital can do is really look at those rehospitalization rates too. And that's the patient safety component with the discharge end of things. So people don't end up back in the hospital where they get no reimbursement for certain diagnoses if they rehospitalize within 30 days. And then it's advocating. I've been successful in advocating to increase Medicaid reimbursement rates to skilled nursing. And so I've already done that. So I know that that can be done with hospitals as well.
Okay, thank you. All right, we're ready for question 3. What is your position on provision of lawful abortion services by our district's hospital and clinics? Tom Oblak, you are first with 1 minute.
I support women's rights, both personally and professionally.
Okay, did you want to say anything else about that?
No, that's fine.
Okay. Jim McIntyre, you have 1 minute.
Well, I've read the policy that the hospital has that's accessible online regarding abortion services. It complies with the state law found in RCW Title 9. And I'm happy to comply with the law if I'm elected. That will be the oath that I take to perform my duties faithfully and impartially. And complying with the law is a bedrock principle of any elective office.
Okay, thank you. Tom Hightower, you have 1 minute. You're muted, Tom.
All right.
There you go.
I've said this before, I'm in support of women's rights to abortion services. I'm also supportive of all health services necessary for women to meet their healthcare needs. But I'm in a position where in the future, if there is any discussions regarding abortion changes or services provided, I would support the idea of having the dialogue and being open to what is the appropriate. But in hospitals, this is an extremely complex issue, and it would need to require a great deal more talk and discussion to change the services as we currently provide them.
Thank you. Heather Jeffers, you have 1 minute.
You know, I feel like if we are going to be a public hospital, then we need to provide all services. And I feel really strongly about not only just about women's rights, but that, again, all healthcare should be able to be achieved here on the peninsula. I think if we have providers who are able and willing and capable and provide that service, then we should be able to provide that service to patients without any opinions about the ethical or moral situations about, you know, the controversy. I just think that I don't think that women should have to leave the area to get services that are legal. And if we are, you know, a private hospital can pick and choose who their patients are and pick and choose what kind of services they provide. But if we're going to stay a public community hospital, we need to provide all services to everybody.
Thank you. Karen Rogers, you have 1 minute.
I support the law and the policies as they stand. It does provide for the right for women as it's been passed by law, both at the Supreme Court level and at Washington State. And when you register to sign up for office, the first thing you do is you sign the oath that you will uphold the law. And therefore, I uphold the law.
Okay, thank you. So we're ready for the fourth question. And this is one also that you've already mentioned, so you're going to get a little more time with it. What steps can be taken to assure that the hospital remains public, not controlled by a private group or entity? Are there pros and cons to maintaining a public hospital? Jim McIntyre, you have 1 minute. I think you might be muted.
Well, given the payer mix, yep, I'm unmuted now. Given the payer mix that that exists, I doubt the hospital district as a whole would be an attractive takeover target. There may be certain aspects, certain services that the hospital provides that might be cherry picked by another entity. Again, to repeat, the main things that the board can ensure to keep the hospital district under local control is to remain financially viable. I've already talked about that. There is a constellation of healthcare providers in the county inside the hospital district. If we maintain strong partnerships with all the other providers, the Jamestown Clinic, the North Olympic Healthcare Network, all the free clinics, so on and so forth, Peninsula Behavioral Health, that'll ensure
your minute is up, Jim.
that I think yep.
You could finish your sentence.
Yep.
I know you can't see the timer, so I have to rudely interrupt you. Okay.
Yeah, well, thank you for being rude. I appreciate that.
Okay. It's not what I enjoy doing, but okay.
Yep.
Tom Hightower, you have 1 minute.
To kind of echo what Jim already said, I think the key to survival of keeping it in local control is financial performance. Market competition and picking at the edges of our market of certain services is going to be an issue. And so I would say that the hospital has positioned itself as well as it can, given its partnerships, given its financial performance, and that and a strong community need and demand that this be kept at a local control. But I also agree with Jim that since we're 85% federal or government reimbursed, we're not much of a target, but some of our market might be the target. So ensuring that we provide services we can in the community and ensuring that the services are quality is the best defense for any intrusion by an outside provider. Thank you.
Thank you. Heather Jeffers, you have 1 minute.
Did I unmute? Okay.
You're fine. Yeah.
Okay, good. Yeah, just to reiterate what the others said, the key is obviously financial viability. There's usually no other reason that a hospital is taken over by larger entity. Definitely we'd have to support ourselves. And the pro is that we keep control of our hospital services. We are governed by a elected board that are speaking on behalf of constituents, rather than a big hospital entity coming in and making decisions. So that's the pro, and yeah, the key is financial viability.
Thank you. Karen Rogers, you have 1 minute.
Very important, OMC cannot be everything to everyone, can't provide every service, but OMC can be amazing at ensuring that we remain locally controlled and locally operated by a sustainable financial plan and understanding the market that helps make up the difference of the payer mix. We've already had Group Health and Virginia Mason leave this community. And based on our payer mix, we are not an attractive business model for a takeover. However, critical services provided are what help offset the budget constraints that we have. But again, knowing from a business model, what are we the best at, and making sure we do that the best that we can.
Thank you. Tom Oblock, 1 minute.
I'm a member of the Strategic Planning Committee, and that committee has 7 major categories of topics that will help OMC remain locally owned and operated and financially viable. They are quality and safety, community relations, staff relations, medical staff relations, facilities and technology, financial stewardship, and advocacy. These topics have quality indicators embedded into them, and these indicators are reviewed by the entire board on a quarterly basis. Adjustments to the strategic plan can be made at any time to suit current market conditions.
Thank you. Okay, we're ready for question 5. In 2008, a little over 60% of Clallam County voters passed Washington State's Death with Dignity law, or medical aid in dying. What role does the hospital have in ensuring access to this law's provisions? Tom Hightower, you're first this time with 1 minute.
The hospital clearly provides services regarding care for the ill and for the terminally ill patients. But to tell you the truth, I do not know exactly what our policies are regarding death with dignity and all of the concepts or all of the provisions of death with dignity. But it is something that I personally hold as being an essential part of a human right to make a decision regarding their own life. And so this is one topic I plan to follow up on and see exactly what within the hospital are our services and our breadth of services to make myself a little more knowledgeable about this. But I do support it as a human right. Thank you.
Thank you. Heather Jeffers, 1 minute.
This is a topic that is near and dear to me. I've been involved in this in many different ways, personally and professionally. Personally with family member. And again, I go back to this is illegal. It is legal. OMC currently does not support this. I know that with my family member, who wanted to pursue this, it was really hard, and it was really hard to find providers. There was no providers within OMC that were willing to participate. There's no pharmacies locally willing to participate, and it made it really hard. I feel really strongly that, again, a service that is legal, if we have providers that are willing to participate, they should be allowed to.
Okay, thank you. Karen Rogers, you have 1 minute.
First of all, it was passed by the voters. It is legal. OMC does have a policy. I've read the policy and I support the policy that they have. Number 3, this is a patient-initiated request. This is not a medically prescribed procedure. There's a significant difference. And if you read the annual report with the Department of Health filed with the governor's office, you will find that death with dignity does not take place in a hospital. It takes place at a patient's home or a hospice facility or at a skilled nursing facility. It's a private time that a patient chooses this. And so the hospital does not prevent any of our doctors from providing that, but at the same time, the doctors have a right to choose. We can't force doctors to do this. However, there are a doctor that is available for this. And so it's very important. This is a very detailed process initiated by the patient.
Thank you. Tom Oblock, you have 1 minute.
OMC respects the religious, cultural, philosophical, and personal wishes of all patients. However, as an acute care facility, we do not think that that is the setting for end-of-life medications. We could go to hospice, or we could go, and I think most people would prefer to be at home and end their life around loved ones and those who care about them.
Thank you. Jim McIntyre, you have 1 minute.
I have read the policy that OMC has available on its website. I agree with it. I believe it strikes a good balance between the legality of the self-initiated or patient-initiated end-of-life procedures and the reason why the hospital is there to begin with, which is to save life and preserve life. So I'm certainly happy to follow the law, but I think it's appropriate for a self-administered medication such as in this instance. It's best to do that in a home setting or a hospice setting or some other place other than the hospital. I do agree with the policy that has been passed by the hospital board.
Thank you. Okay, we're ready for question 6. If elected, what climate actions, if any, would you support that would reduce the hospital's carbon emissions and overall environmental impact? Heather Jeffers is first. 1 minute.
Could you repeat that question, please? I wasn't.
Sure. If elected, what climate actions, if any, would you support that would reduce the hospital's carbon emissions and overall environmental impact?
I'd have to do more research on that to know what the issues were. So.
Okay.
Sorry.
Okay. Karen Rogers, you have 1 minute.
Well, actually, on the capital projects that the hospital does take on, they do look at it from an environmental compliance policy. What can they do to reduce the impact, and also looking at the possibility of LEED certified expansions and additions. So the hospital construction team does review that.
Thank you. Tom Oblock, 1 minute.
Hospital has for years been engaged in recycling programs, minimized packaging, and one of my positions at OMC was hazardous materials coordinator, and there was a lot of a push on to use less toxic chemicals in our day-to-day operations. This, I hope, is a good start, but there needs to be more done to address climate change.
Thank you. Jim McIntyre, 1 minute.
I'm unclear personally on what the carbon emission profile of the hospital district is, to be honest with you. Things that make sense at the outset are being as energy efficient as possible, looking at things that make good business sense, good financial sense, but also result in energy and carbon efficiencies, things of that nature. But everything has to take second place toward in favor of a healthcare system that is affordable, available, high quality, and patient centered. That's the four things that are the most important to the citizens of Clallam County that the board represents, and the patients of the hospital in all of its aspects.
Thank you. Tom Hightower, 1 minute.
Yeah, I'd like to follow up on Tom O'Block's comments. I would agree that I think the biggest carbon footprint that a hospital would have is in the materials that it uses, since it uses a lot of plastics and other types of materials. And so looking at recycling and looking at other options insofar as materials. I mean, the hospital does not have a big carbon footprint, carbon emissions, vehicles and such, but the hospital has been consistent on having all new buildings and capital budgets or capital expenditures and programs LEED certified. So it is available. I mean, it is conscientious of this issue and continues to be that way going forward.
Thank you. Okay, we're ready for the next question. We have, all of you have mentioned budget. So this question is about the health needs assessment, the community health needs assessment. Please share your thoughts on the hospital budget and how it reflects the community health needs assessment. Karen Rogers, you have 1 minute.
Regarding the community needs assessment, I've read the report. Also, I've seen how the commissioners, and I salute the hard work of the commissioners currently, what they've done with that, and they've taken that and meshed that into the strategic plan to meet those suggested, and also the health standards that have been reviewed by the assessment report. They have done a very good job of also taking that and compiling it into what is in the budget that's available. So I've listened to many presentations at the board meetings in regards to that, and I've also participated in a couple of the community roundtables associated with that, and also followed up on another community assessment report done by North Olympic Healthcare. And so I salute what the commissioners have done, and I believe that they are effectively matching the assessment to the strategic plan. And I would support that.
Thank you. Tom O'Block, 1 minute. You're muted, Tom.
The community health assessment brings to the top two key issues, and that is opioid addiction and behavioral health. OMC has formed a partnership with Jamestown with the MAT Clinic. The first phase of the MAT Clinic is to address the opioid addiction portion of it. The second phase is a 16-bed inpatient psychiatric hospital that will be staffed by OMC physicians. This will help move patients that have behavioral health issues from the acute care setting to a specialty area. I support the MAT. I have supported the MAT from the beginning, and I cannot wait until it is completed. Our providers have reduced prescription opioid scripts by, I believe, 33% over the past year.
Thank you. Jim McIntyre, you have 1 minute.
I'm going to echo Karen Rogers's answer to the question because I think it mirrors mine. In addition, I'll say that the health needs assessment is more of an unconstrained look at the world of healthcare, the state of healthcare in our county and in our hospital district. The budget and the strategy that OMC adopts bring in fiscal constraints, strategic choices, financial choices. And it appears to me from the outside that all of those things mesh pretty well. The board, as it should, and as it does, should continually keep the connection in mind between the health needs of the community, of the citizens that we serve,
You
And
have
the
10
possibility,
seconds.
yeah,
10
and the
seconds.
thank you. And the possibilities afforded by the financial condition of the hospital.
Thank you. You stopped right when the red came up. Congratulations. Tom Hightower, you have 1 minute.
Following up on the other Tom's comments, the behavioral health and opioid addiction being the top two issues in the health assessment of the community. One of the things, in addition on the opioids, the hospital has been a leader in the state in regarding the changing of prescription patterns and working with physicians to change what they're prescribing, which is one of the core reasons why we have some of the opioid issues that we have. We also, in the behavioral health issue, this is an issue that is far from being totally controlled, but we have partnered with agencies within the county and have also changed resources within OMC that provide the type of resources and support of individuals with behavioral health issues. And finally, just a comment, one area which the health assessment has not shown is the issue of chronic illness in this community, whether it be cardiac, whether it be diabetes, whether it be cancer. These are things that I think the hospital needs to continue to focus on going on in the future.
Thank you. Heather Jeffers, you have 1 minute.
I'd like to reiterate what Tom and with what he said with the strategic plan. So I've read the strategic plan, I've read the community needs assessment, I have participated in the community needs assessment, and the top two areas are with the addiction, the opioid addiction, and behavioral health. So those are two things that are in place with that. What I'd like to see is a little bit more looking into more of the geriatric population with behavioral health, you know, the geriatric mental health issues, because currently right now, there aren't any services on the peninsula for that, and those people have to be sent out of county. So I think that would be another added area to look into.
Thank you. Okay, we're ready for question number 8. So this one is about staffing and housing. And we have done school board forums, and we know that in this county we have housing shortages, and also one of the things that we know, when doctors and nurses come to interview at the hospital, they want to know about the schools and they want to know about the housing. So those are two issues that really are fundamental to the hospital's operations and related to the staffing. So could each of you give your thoughts on how the hospital might or should not support the school system, and also support city councils who are working on housing? So let's see, who's first? Tom O'Block. You have
Yes.
1 minute.
The housing issue is a community issue. We have some housing coming available on the corner of Port Williams Road and Swim Avenue, but it's not enough. We need more housing in the area. OMC is a good community partner, but it's going to take the whole community to resolve this issue. Regarding the schools, the OMC board has passed a resolution for every school bond or school capital project that has been presented for us. You're right, the schools do have an opportunity for improvement, particularly here in SWIM, as PA has passed a capital levy, I believe, a few years ago. But it is important both for schools and for housing. Another issue that I'll bring up is the trailing spouse. We need to find jobs for the trailing spouse of these physicians or whoever may be coming to the area.
Thank you. Jim McIntyre, you have 1 minute.
Well, those are certainly good topics, and I would lend my support if I'm elected commissioner to any efforts that the cities and the county might undertake to make it easier and reduce the barriers to entry for the private sector to build more housing and make it more available for any professional. We might even think about, as I've mentioned before in other forums, might even think about banding together with the PUD, with the school districts, and seeing how it might be financially possible to build staff housing in some sort of a public-private partnership arrangement with the private sector or the private home builders in the county. The community
You
needs
have 10 seconds.
Thank you. The community needs to support all of those efforts. So it really demands an outreach effort by all elected officials in the county.
Thank you. Tom Hightower, 1 minute.
I think the issue of housing has been well covered by the other candidates. I want to touch on the fact of staffing and the challenges of staffing and manpower within the hospital. The hospital has taken on a few projects or a few areas of advocacy. It's expanded the RN program, it's expanded the medical assistant program and the CNA program so that more and more local individuals, local community members are able to go to school here within the county to be able to find jobs here. So growing our own within Clallam County is an essential part of that. The other piece is that there are schools and there are training programs outside of the community, and the hospital has taken efforts to make sure that there is support, financial support for individuals who want to go out to programs outside of the community to meet some essential and short-staffed areas. We are seeing a workforce that is retiring, and this is going to be an ongoing issue for the near future.
Thank you. Heather Jeffers.
Yeah, I agree with Tom Hightower on that. You know, the OMC needs to really partner with the schools, of course, to support the bonds. In Squim, we have an issue for the past number of years where they haven't had ability to get the bonds passed. And, you know, in my position, what I'm finding all the time is people, you know, in recruiting, people coming out and then they're not happy with the schools, of course, and they leave, or they can't find housing. I think that there could be more done with the city councils and with the Realtor Association and working on the housing situation and of course, working on the staff retention and different things that can be done in-house with improving retention. And I think that OMC is doing a great job with all of that and just continue with what they're doing and head in the right direction.
Thank you. Karen Rogers.
The OMC has worked very hard with the school districts in getting helping with the bonds and the levies. I actually co-wrote the last bond and levies for Port Angeles school districts and actually worked with OMC through the foundation on that specific. It's key. Housing. Right now, the cities, counties, PUDs are sitting on cash from the recovery plan. They should be looking at everything they can do to make infrastructure ready lots, therefore reducing the cost of the build of the housing. But here's another key piece that's missing. In addition to trailing partners and spouses jobs, there is also a child care issue. And once again, we could be partnering with Peninsula College, Child Care Development Plan, and have the ability to have child care at both Squim and Port Angeles campuses, further ensuring the ability of employees to have access to child care. That's not meant to be compete, but to be collaborative. And that's another critical need.
Thank you. Okay, we've come to the end of our questions right now, and it's time for your 1 minute closing statements. And then after we do that, we will hear from Patrice Johnston, who is running for the Squim School Board. But first, we'd like to have all of your closing statements. You will each have 1 minute, and Tom Hightower is first.
Again, thank you all for being here this evening and hearing us talk. And again, I am humbled by the candidates that are here with me tonight. They've all shown great insight and some great ideas and values that I think support our health in this community and an organization like OMC. I have been 4 years on the OMC board. I've been very much involved with a variety of issues. I'm primarily, as Tom O'Black would know, I'm primarily on the clinical side insofar as making sure that the quality of care is sustained and that the patient care is safe also. But I do not diminish the fact that financial health of the organization is also necessary to make sure that we continue with the services and we continue local control of OMC. So I support that. And I thank you for your support, and I thank you for your vote. And thank you for tonight.
Okay. Jim McIntyre, you have 1 minute.
Thank you again for the invitation and for the opportunity to answer some very interesting and thorny questions. I bring a unique set of experiences and skills to the OMC Board of Commissioners. I continue to have a passion for public service and the zeal to serve the citizens and patients of the hospital district. And I certainly do know, having been in executive positions and governance positions, the difference between the two. The board's task is governance, and I am fully prepared to jump on that horse and ride it as fast as I can in conjunction with my fellow commissioners. Thank you again for the opportunity to be with you tonight.
Thank you. Tom O'Block, you have 1 minute.
Thank you for having me tonight. My healthcare career began in 1971 in Clarksburg, West Virginia. I am a poster child for the career ladder in hospitals. Each rung of the ladder has brought me new challenges, new terminology, new relationship, and new regulations. The rungs of this ladder have prepared me to be a hospital commissioner. President Trump said during his term that healthcare is a complex issue. Not only is it a complex issue at the federal level, it is also a complex issue at the local level. This is not a job for on-the-job training. Thank you very much, and I ask for your vote.
Thank you. Karen Rogers, you have 1 minute.
Thank you for your time this evening. You've heard from me directly on my qualifications, my goals, and my comprehensive overview and knowledge of OMC. I'm a huge patient advocate, having taken many patients off the peninsula to get their services and to come back and make sure they were taken care of very well at OMC. I will serve you with passion, and I will serve you with integrity. And I bring to you a very unique skill set, having been an elected official, serving this community for 8 years, very experienced with comprehensive, complicated budgets. And I bring to you the community perspective. I will serve as your representative, and I humbly ask for your vote. Thank you again for tonight.
Thank you. Heather Jeffers, 1 minute.
Yeah, thank you for your time. I'm glad I was actually able to join at the last minute. So my experience in post-acute and long-term care brings unique perspectives that is very important in the hospital setting. It is one that hasn't been on the board for a very long time that I know of. And you know, my career has been spent advocating for patients and families in healthcare. And I understand the complexities of being in this rural healthcare area and improving quality, having quality outcomes, improving financial outcomes, very limited resources with reimbursement rates that are very limited and thin margins. And I think, sorry, having technical difficulties. And I just, you know, I'm really passionate about pursuing this. I'm sorry, I'm getting interrupted here and I'm having a hard time. So I just appreciate your time and I ask for your vote.
Thank you. So now it is my turn to thank all of you. It's not an easy thing to be a candidate, and we appreciate all of you being willing to be here tonight and answer our questions. And what we will do now is we will hear from one person who is running for the Sequim School District Board. Let's see, Sarah, is Patrice Johnson on? I can't see anybody, so I need to know if she's here.
I didn't see that name among the participants.
Oh, you
Patrice,
don't?
if you're under an alias, please let us know and I'll spotlight you.
All of the candidates for the school board were invited to introduce themselves tonight and answer the same 3 questions that we ask all candidates. And Patrice was the only one that said that she could be here. So maybe something has come up and she isn't able to.
I didn't see her at the beginning when you mentioned it, and I don't think she ever arrived. So.
Oh, okay. Oh, I'm sorry to hear that. Okay. We aren't doing a forum for the school district because we didn't have enough candidates say that they would participate. So, all right, then I guess we're gonna close for tonight. I want to remind all of you to go to that vote411.org site. It's an excellent site, and also check out the League's website, lwvcla.org. Lots of good information on there. We have a lot of different things going on. The ballots will be mailed October 13th. And I would say, we communicate with the auditor's office because we're watching everything that's happening. And we have an exceptional auditor's office and service here in Clallam County. So I would encourage everyone, if you have questions about voting or anything that you want answered, the auditor's office is always there and willing to help. I want to thank again the Olympic library system, and specifically Sarah, who has just done an outstanding job for us, and Bonnie for our timing. She always does a good job for us too. So this forum will be posted on our YouTube site, and you could go to our website to access that. Let's see, this is Thursday. I don't know, Bonnie, maybe tomorrow or by the weekend. I'm not sure the timing of that.
Probably by the weekend. It takes a little while for us to get it uploaded. So I'd say give us a day or 2 for sure.
Okay, and it'll be posted there for everyone. Thank you very much. And I will say good night to all of you.